It is 50 times more potent than heroin, 100 times stronger than morphine. And the feds say because of the work of the Sinaloa and Jalisco New Generation cartels in Mexico, fentanyl is easier for young people to get and more irresistible since it's showing up in rainbow colors. It's proven a deadly threat across our region. In San Joaquin County in particular, the state has logged a 30-fold increase in the rate of fentanyl-related overdose deaths in just 2 years. Daniel Kim, the coordinator of public health education in San Joaquin County, part of a coalition intending to put an end to all of that with a special outreach event to the community, especially parents and teens. With me now live this morning. Daniel, welcome to Fox 40 News at 11.
Good morning.
Good morning. 48 people lost their lives last year in your community to fentanyl. Half of those were between 14 and 35 years old, just 14, the beginning of that age range. And with the power of this drug and with what's sold maybe being mixed with something else, someone could lose their life the very first time they use.
Yeah, a lot of people don't realize, where you can find fentanyl. It's not necessarily a drug by itself. It is mixed with other drugs that may be found in the streets. And that's what we're trying to raise awareness of. It takes just a head of a pencil, the tip of it, if that amount is a fatal dose of fentanyl. And so we want to make sure that people are aware of where you can find potentially fentanyl and, what the dangers are and how to combat that in case somebody is overdosing.
Rainbow-colored pills have shown up in our region and 21 other states since February of this year, so it's obvious the traffickers are targeting kids on the street. These things are being called Skittles or Sweet Tarts. You're planning a town hall for next Monday to talk about the dangers. Do you find that parents know very much about this at all or not?
Not a lot. I think they may be aware, that some kids are using certain types of drugs. What's happening is that they're being found in what they call, study drugs, such as Xanax or Adderall. But instead of getting the actual, safe prescription pills, it may be laced, and very likely that it's laced with fentanyl. Really, unfortunately, they're being manufactured in the U.S. As well as coming overseas. But by being mixed with these pills, if you don't know where it's coming from and you're getting it from either online or by somebody who's selling it, there's a chance that it could be laced, and that one pill can kill.
Senate Majority Leader Chuck Schumer just this week started a new push for new funding to fight the spread of fentanyl, but that's something that will take time. In this upcoming town hall, what's the #1 tool you want to empower parents with to help their kids stay away from all this, and how do you convey the seriousness of the threat to teens in our area?
I think one is sharing, the data, because I don't think people are realizing, how much is happening. Again, you mentioned that we've seen a 30-fold increase in terms of overdose deaths, but we've also seen probably a higher rate with regard to overdoses and fentanyl poisoning itself. So we want to make sure that people are aware that there is a risk, especially getting and using street drugs and anything that they may have typically used, because nowadays we're finding that fentanyl is almost found in a lot of those overdose situations.
Monday's town hall will be in person in Stockton at the Wentworth Education Center from 5:30 to 8, and also virtual. So folks should be able to see at the bottom of our screen how to RSVP and how to log in, information that we're also going to put on our website. With the virtual component, folks really all across the region can tap into this content and hear what may be a life-saving message, right?
Absolutely. We want to get as many parents as well as the youth to be aware that they are at risk if they are exposed to fentanyl in any way, or potentially taking risks in using drugs that they really don't know where it's coming from. It puts them at risk, and we want our kids, our students, and our parents to be aware and to inform their kids about these drugs that are out there. And we want to tell stories. And unfortunately, we will have, cases and individuals sharing their personal stories of those who have lost lives.
Today, a young person in our area may be faced with the offer of some fentanyl, or a parent may discover their child has already developed a problem with this drug. What would you want to say to them that can make a difference today?
if they know that their child is potentially at risk, one of the key things is to be able to, save them. And one of those tools would be the use of Narcan or naloxone. It's an opioid reversal drug that can be administered if somebody is experiencing an overdose. So we want to make sure that the families, individuals that may be at risk, have those available and know how to use it. So we will also be providing a training for those who want to obtain a packet that we will be sharing and with the group, and really be aware of, again, the risks that using drugs that you don't know where it's coming from, to avoid having an overdose or severe consequence of death.
Alrighty, thank you so much for joining us this morning to talk about this upcoming town hall that really everybody across the region can tap into, at least virtually. That is, again, happening on Monday from 5:30 to 8. That information will be on our website, fox40.com. Thank you so much.
Thank you.